Everyone, my name is Rick McIver, and I have the honor to serve as Alberta's Minister of Transportation and Municipal Affairs. Thank you for joining us virtually. I'm very pleased to be here with Premier Kenney for a significant announcement for Alberta's truckers and for their families. To that end, we're also joined by Chris Nash, President of the Alberta Motor Transport Association. Alberta's transportation network is the backbone of our entire economy. Without it, we couldn't move our goods to market safely and efficiently. We simply wouldn't have the industry and jobs that we have today. And as many of you know, Alberta's transportation sector has been working non-stop since the beginning of COVID-19. They've kept our communities fed and made sure our goods would continue to get to world markets. As international borders tighten up, we worked with our partners in the federal government and across the border to make sure truckers were deemed an essential service. Our goal was for drivers to not be subjected to border restrictions for non-essential travelers so we could keep critical supply lines open. And with the cooperation of the U.S. government and Canada, we were successful. We provided emergency Class 1 road tests to make sure we still had enough drivers to fill those seats in the trucks. And when you were on the road, we ensured provincial highway rest stops and other amenities were open and stocked for those much-needed breaks. Today, our goal is to get past the pandemic, to stop the spread, and to stop the spike. We know the best way to do that is to get jabs in arms. I would now like to invite Premier Kenney to the podium to tell us one more way that we're supporting the movement of goods and vaccinating Albertans as quick as we possibly can. Thank you.
Thanks very much, Rick. Appreciate the good work of people of transportation over the past year, especially our truckers who have kept critical supply lines open from the very beginning. So good morning. Earlier this week, I announced a major expansion in our vaccine rollout to protect Albertans and prevent our healthcare system from being overwhelmed by COVID-19. It's a very big step forward for us to open vaccinations to all Albertans aged 12 and older starting this coming Monday. By next week, another 1.3 million Albertans will be eligible for the vaccine. And I'm happy to report that Albertans are responding positively to this good news. As of yesterday evening, 136,000 vaccine appointments have been scheduled in the 30 years and older age group, and we anticipate tens of thousands more will be booking their first shot next week. The good news is we now have a large supply of vaccines coming into Alberta over the next several weeks. And today, I want to talk about a special initiative to get vaccines into the arms of even more Albertans. I'm very pleased to announce that we've signed an agreement with the government of Montana to vaccinate truck drivers who are required to cross the Alberta-Montana border as part of their job. Truck drivers have worked hard throughout the pandemic to keep the supply chain open and deliver the essential goods that Albertans need. And that's why Alberta is taking further measures to protect the health and safety of these workers. By vaccinating truck drivers who travel across the Montana-Alberta border, we're protecting them from COVID-19 infection, and we're ensuring supply chain remains open during the pandemic. Truck drivers will be vaccinated with surplus vaccine supplies provided by Montana. There will be no cost to Albertans for this vaccine program, as the United States government will be covering the cost providing and administering the vaccine for the states. I want to thank Governor Greg Gianforte of Montana, with whom I spoke earlier this week, for his extremely generous cooperation in this initiative. Because of Governor Gianforte's leadership, we'll be able to keep essential goods moving across our border during the pandemic and offer greater protection to our truckers while ensuring more vaccines can get into the arms of Albertans. Starting next Monday, May 10th, the Government of Montana will be providing vaccines to truckers entering the state at a rest stop near Conrad, Montana. About 2,000 Alberta truckers are eligible to receive a vaccination in this program. If there's excess demand, we can talk about expanding it, but that's the initial estimate and set aside. Montana will be providing the Janssen vaccine produced by Johnson & Johnson during the program, which only requires one dose. Truck drivers will not be required to book ahead to receive the vaccinations. There is a constant flow of trucks crossing the Alberta-Montana border. In fact, about 800 commercial carriers cross the Alberta-Montana border at the Coots land border crossing every single day. We're confident that many truckers will pull over, roll up their sleeves, and get their jab as they travel back and forth between our province and Montana. This program is similar to other agreements reached between the provinces of Manitoba and Saskatchewan with the state of North Dakota to vaccinate truck drivers and other workers. The initiative we are announcing today is just part of our effort to get vaccines into the arms of all Albertans as quick as we can. I want to close by thanking the truckers who have driven thousands of kilometers and worked day in and day out to ensure that our communities have the food, medicine, and vital goods throughout the pandemic of the past year. I also want to pause to say thank you to the Blackfeet Nation in northern Montana for having provided, I believe, up to 1,000 vaccines on short notice to Albertans on occasions when they've had a surplus. First of all, helping to inoculate their brothers and sisters in the Blackfoot Nation in Alberta, but then also some members of the general public from Alberta. It was a really wonderful and gracious gesture on their part. So we say thank you to everyone and the truckers for all that you do and continue to do to deliver essential things that we need, and we wish you safe and healthy travels. I'm now pleased to turn it over back to Minister McIver to hear just a little bit more.
Thank you, Premier Kenney. And as the Premier said, around 2,000 Alberta truckers will be able to get vaccinated across the U.S. border in Conrad, Montana between May 10th and 23rd. It's one part of our government's vaccine strategy, but we think it's an important one. As the Premier said, this would not have been possible without the leadership of Montana Governor Greg Gianforte. Unfortunately, Governor Gianforte is unable to be with us this morning. However, he did provide a statement, which I have the privilege of reading to you now, and I quote, "The pandemic has had devastating consequences, including a severe impact on our economies. By working together and taking this critical action, we keep our trade channels open between Montana and Alberta. I am grateful to Premier Kenney that we can band together to prevent the spread of COVID-19, protect truckers and their families from the virus, and ensure we maintain the exchange of goods that our communities rely upon. Montana will continue working to maintain our strong bonds with the people of Alberta." So once again, thank you, Governor Gianforte. Alberta's transportation industry has a strong reputation for safety. As Minister of Transportation, I am so grateful that we can take this action to protect our transportation professionals from COVID-19. On behalf of all Albertans, I want to join Premier Kenney in thanking all of Alberta's transport companies and all your hard-working drivers and support staff for all that you do. In tough times, you kept the shelves stocked with food and with medicine. Now, I would like to invite our final speaker this morning, Chris Nash, who is the president of the Alberta Motor Transport Association, to provide some remarks. Thank you.
Good morning. Thank you, Premier Kenney, Governor Gianforte, Minister McIver, for the opportunity to speak today. And as well, we'd like to thank Dave Williams, the CEO of the Motor Carriers of Montana, for helping get this across the line. Each of you shares the Alberta Motor Transport Association's commitment to helping our industry and our two countries get to the other side of the pandemic as soon as possible and as safely as possible. Today's announcement could not have happened without a shared vision for the future of trade across our borders. It couldn't have happened without the cooperation of all those who work in our industry over the past year and the support of our respective governments. It wasn't long after the pandemic took hold that commercial transportation workers were recognized for their roles in our daily lives and the critical role they played in the pandemic as essential workers. Essential goods make their way to market from essential workers, commercial drivers. Canadians and Americans enjoy a good quality of life because we share a commitment to keep essential services running, especially during a time of crisis. And while the pandemic has certainly impacted our quality of life, the vaccines commercial drivers bring to market are helping to restore it. This agreement between the governments of Alberta and Montana to inoculate Alberta drivers is proof that collaboration can help our communities and economies recover. Agreements like this help keep essential workers safe. This is how we build and maintain a resilient supply chain. The Alberta Motor Transport Association is grateful for this donation of vaccines, and we're honored to be a part of this proud and historical moment when our two countries take a significant step forward together to end the pandemic and to protect our people, our supply chain, and our economies. And again, thank you to all the drivers out there for what you do every day to make our lives better.
Great. Thank you very much to our presenters today. We'll now go to the lines for questions. Just a reminder to individuals on the line that we have time for one question and one follow-up. With that said, operator, could you please put through the first question?
Hi, thanks for taking my question. This is for the Premier. Vaccines open up to every Albertan over 12 as of Monday, and some Calgary officials say we may not have the capacity or staff to keep up. Are there any plans to increase resources in municipalities across the province to keep up with that demand?
I'm sorry, demand, you're talking about in vaccines? Is that the question?
Yes, the demand to be vaccinated.
Well, I can give you a very specific answer about where we're at in that respect. Look, first of all, we opened, as you know, on yesterday we opened for booking the next phase for everybody 30 and over, and we've had an amazing response, well over, I think it was over 130,000 bookings in the first day, which has exceeded our expectations. And we have seen actually relatively more bookings in Calgary than in other health zones. So Alberta Health Services will be readjusting their supply allocation to match the demand where it is. We don't want to turn anybody away, obviously. I can tell you that right now we have, we can have somebody get back to you with the exact state of play with respect to doses in the Calgary zone. But we believe that with incoming supply, we should have adequate supply to meet the bookings that have been made over the next week in every health zone. And we've actually, we have more bookings in all zones now than we have supply available right now. But what we're banking on is additional incoming supplies. So this week we estimate about 350,000 doses. Next week, week of May 10th, we'll be receiving 271,000, and the following week, 357,000 doses. So that, and then of course we then allocate those to AHS vaccination clinics, the rapid flow-through clinics, the pharmacies, doctors' offices, etc. So I'm just looking for the Calgary-specific data to share with you, but I don't seem to have that. So we'll have somebody from AHS get back to you with a specific answer about where we're at with respect to the Calgary zone doses right now.
Do you have a follow-up question?
Yeah, I do. So when it comes to staffing and actual resources for getting vaccines in people's arms, are there any steps for opening up possible additional mass vaccination sites or supplying more staffing to the Calgary zone?
Well, we may be opening up some mobile clinics, additional mobile clinics, but mainly what we'll be doing at this point, first of all, let me remind you that we've got AHS vaccination centers all across the city. There's several. There's the rapid flow-through clinic at the TELUS Convention Center downtown that can do, I believe, up to 10,000 doses a day. They've been typically averaging about 6,000 a day there. And in addition, across the province, 1,300 plus pharmacies delivering vaccines, about 400 of those in Calgary. But what we're looking at doing now is expanding this to, as the population of people eligible for the vaccines increases, we're going to be doing more community partnerships. So, for example, large-scale employers, we are in discussions with a number of them about doing rapid vaccination clinics in their workplaces. We're reaching out to ethnic and cultural communities to make sure that we're delivering the vaccines in a convenient location that is culturally sensitive. We may reopen with the Native Friendship Centers and the Métis Nation clinics specifically for their populations to encourage uptake. So there will be a broader array of, I would say, community-specific opportunities to get vaccinated. As you know, for example, right now in Calgary Health Zone, we have the specific vaccination program down at the High River, the Cargill plant, meatpacking plant in High River. So that's an example of the sort of rapid clinic that we're setting up in particular workplaces. There will be more of those.
Thank you. Operator, could you please put through the next question?
Tim Brooks, CTV.
Thanks so much. My question is for the Premier. I'm just curious to know, now that everyone in Alberta is almost eligible for vaccination, what's your personal message to your caucus about the shot? Are you asking everyone in that UCP caucus to get vaccinated?
Well, it's the same message I have for all Albertans, which is to strongly encourage everyone to get the jab as quick as they can to keep themselves and their loved ones safe. We'll be launching a large advertising campaign with some fresh messaging to especially break through to people who have had doubts or skepticism about the vaccine. I haven't heard any of that in my caucus. I've heard people, my colleagues, as far as I know, intend to get vaccinated and have as soon as they have been eligible. So I think this is really a message for all Albertans. We do know, this is good news, that in the public opinion research and the polling, we've seen an increase over the last few months in the percentage of Albertans who intend to get vaccinated. When we started out about 6 months back, it was about 30% of Albertans who seemed fairly reluctant. Pretty consistently, 10% have said they're just not going to get the vaccine. And as you know, there's always a minority of the population who are just skeptical about or opposed to all vaccines for whatever reasons. And there are, of course, there is a small share of the population who, for their own health reasons, may receive medical advice not to take the vaccine. But what we've seen initially was sort of a 20% group of Albertans saying that they were open to taking the vaccine, but they wanted to wait and see. And I think what they wanted to wait and see was how safe it is. And I think now they can see that, a third of our population, 40% of Alberta adults, and hundreds of millions of people around the world have received the vaccines with very few negative results. In fact, what have we reported so far? After we've done we're approaching 1.8 million doses administered, and in Alberta, we've reported 282 adverse events out of those 1.8 million doses. So the science could not be more clear that the risk of COVID to your health is infinitely greater than the tiny risk posed by vaccines. Not to say that every medical intervention has some level of risk. So that's the message I would send to all Albertans, including members of the legislature.
Thank you. Do you have a follow-up question?
I do, yes. All that being said, I'm just curious to know, what message do you think it would send to Albertans if their MLAs don't get vaccinated or just won't tell their constituents if they plan on getting vaccinated?
Well, I think vaccination is a choice that everybody makes for themselves, and I don't think people go and get the jab because some politician does. I've gone out there as Premier to demonstrate that I got vaccinated as quick as I was qualified. because I do think it's my role as head of government to set an example. But I really don't think people are going to be influenced one way or another by what politicians do on this. And, everybody's they've got free will. No one's being compelled to do this. We repealed the power of mandatory inoculation in the law, partly to remove the concern that some have had that this whole thing is a ploy to force people to get vaccinated. That's not true. People can choose to do this or not. We strongly encourage them to do it.
Thank you. Operator, could you please put through the next question?
Lauren Boothby, Edmonton Journal.
Hi, Premier. The new restrictions that were announced recently include closing workplaces with outbreaks for 10 days, except for those that are deemed critical. But Alberta has had and currently has some long-standing outbreaks with a lot of cases in industrial manufacturing settings, places in some cases I'm sure considered critical. So Ontario Health Unit recently shuttered 2 Amazon fulfillment facilities because of outbreaks. So why doesn't Alberta close all of these places temporarily too? Are they really essential when they're putting workers, communities, hospital capacity at risk? Keeping them open seems to undermine the province's ability to get this third wave under control.
Thanks for your good question. So we just adopted this policy of closing work sites without breaks for 10 days on a Tuesday. There obviously has to be some flexibility for applying that intelligently. Like we can't close a hospital completely if with hundreds of beds if there is, for example, an isolated outbreak. So Dr. Hinshaw and her team are developing the criteria to apply this new policy, consulting with Dr. Bonnie Henry and British Columbia, because they have had a policy like this in place for several weeks. I was briefed on it last night. We understand that Dr. Henry believes it's been quite effective. We are developing, and we will publish in the very near future, in the next few days, the criteria that will be used by Alberta Health Services to apply this principle. So there are going to be some kinds of workplaces, and I'll give you again the example of a fire hall or a hospital, that we can't and won't close if there's an outbreak. We'll just take necessary precautions. Then there are others that will be subject to the 10-day closure in the event of an outbreak. And then there are others that will have to, in the middle, in terms of the nature of the work that they do and the risk that they pose. So that's what BC has come up with. They've come up with a sort of 3 different categories. We are replicating that. We'll be publishing the detailed criteria for this policy in the next few days. And so I can't speak specifically to warehouses. Again, we will leave it to AHS to look at the individual circumstances and figure out where it makes sense to apply the policy. But the general intention is sending a message to employers, first of all, about the importance of following all of the public health protocols, keeping people safe, and responding as quickly as we can when and where there are outbreaks.
Thank you. Lori, do you have a follow-up question?
Yes, I do. So in the event that manufacturing, places like warehouses or industry like, oil and gas are considered critical and allowed to stay open. You have passed a bill recently that gives workers up to 3 hours of paid sick leave to get the vaccine, but a lot of Albertans still don't have any paid sick days at all, so they can't afford to take time off if they have symptoms or test positive. That also undermines Alberta's ability to get a handle on the pandemic. So to be sure, the federal government does have support, but some workers say that this falls short, and that doesn't mean that your government can't also do something as well. So what will you do to protect workers in these workplaces, these critical workplaces, particularly ones that are in industrial or oil and gas or manufacturing, if those are included, that are allowed to stay open with outbreaks?
Sure.
And will you consider bringing in paid benefits to give them an incentive to stay home?
Thank you for the questions. First, a specific comment about oil sands work camps, since I think you've alluded to that. That's the kind of infrastructure which would be extremely difficult to just shut down for 10 days. And that's because those are such large operations that if you turn them off, the the reservoir can be permanently lost and can do massive damage in the scale of hundreds of millions of dollars that would then put thousands of people permanently out of work. So those are the kinds of situations where AHS is going to have to work nimbly with the operators if and where there are outbreaks. With respect to paid sick days, I would point out that we did bring in protection for workers who have to stay at home due to COVID, and they have a 3-week protection in the law. Many workers, of course, have negotiated benefits that allow for paid sick leave, including in collective bargaining agreements and in contracts. There is access to the federal enhanced paid sick leave benefit, which is $1,000 available over 2 tranches of 14 days. So it's up to 4 weeks per year that's available. And then finally, Alberta has, and we were the first province to put in place a benefit for people who are sick and who self-isolate. We provide 14 days of free room and board, as well as $600 over a 14-day period. So if somebody gets sick at a work site, they have to self-isolate, they can go and stay at a hotel, receive 3 meals a day, other support, and $600, all from the Government of Alberta. That is a monetary plus non-monetary support package for sick workers worth over $2,000 for those 2 weeks.
Thank you. I believe we have time for 3 more sets of questions. So, operator, could you please put through the next question?
Helen Pike, CBC.
Hi, this is also a question for the Premier. Thanks for taking it. I'm just wondering, just on today's announcement, I'd be curious to know what the risks these truck drivers have been facing, crossing the border. I know they are exempt from having to quarantine, but I just wonder, are these folks getting sick?
Well, I'll ask, I don't know if Minister McIver has any stats on this, but I'm not aware of any particular challenges with that sector standing out in terms of COVID spread. Obviously, people who travel are taking some risk, but we a year ago, 13 months ago in March, April, at the beginning of the pandemic, one of our main concerns was the threat to our supply chains, that if those truckers couldn't bring food in from the U.S., it could empty grocery store shelves very quickly. And so we put a lot of attention on this, and we've worked with the Trucking Association, the Alberta Transportation Association, and with the trucking companies to make sure that their drivers are following all the necessary protocols. This is not something we can turn off. We can't stop bringing essential goods into the province. And I would say that these folks are crossing the border anyway. They are exempt from the quarantine requirements imposed by the federal government, because if every driver had to sit at home for 14 days after they brought in a load, there would be no more drivers to bring in loads, and we'd have empty grocery stores. So there already have been exceptions made, and this just gives them greater security. Once they get that single dose jab from Janssen, they're good to go. And in this particular case, both governments, Canada, U.S., as well as the states, are comfortable in giving them an exemption from the quarantine requirements. They already have one, in fact, and so this just extends it. So I think it makes eminent sense. I don't think that this in any significant way elevates risk. In fact, what it does is to reduce risk because they are now vaccinated.
Thank you. Do you have a follow-up question, Helen?
Yeah, I guess, so there's 2,000 or so doses right now allotted to this, and I'm just wondering, once those run out, what are the plans or what are the thoughts after these truckers get vaccinated, if there is excess? Will it be border towns? What's the thought process coming up?
Yeah, we'll go back to the government of Montana if we exceed the demand, because Governor Gianforte tells me they're sitting on a lot of excess doses right now. They've vaccinated about half their population, and demand is slowing down, so their supply their available supply is increasing. This is our initial estimate of where we think that the demand will be, but I get the impression that Montana would be happy to expand the program if we need it. And I'll just add to that, we've been in discussions with some other U.S. states. I've been talking to other governors who have said, look, Jason, we're sitting on extra doses here. We know you guys don't have enough. We'd be happy to share with you. The problem we're facing, and this is something I raised with the Prime Minister in our discussion 2 days ago, the problem we're facing is that the U.S. has export constraints on sending doses outside of their country. And that's a U.S. federal government issue. So I asked the Prime Minister if he could once again take this up with the United States, because we've got a lot of states in the Northwest region who see the situation that we are facing, want to help out, but are unable to do so. But I'll tell you this, if Albertans are down south for whatever reason, and they want to get a jab, I think they can pretty easily do so in most of the United States. And I know a lot of snowbirds and others who have done just that. People down there on essential work. Frankly, we encourage them to, because just getting vaccinated as quick as they can helps them, helps us. It's good for everyone.
Thank you. Operator, could you please put through the next question?
Don Braid, Calgary Herald.
Premier, more and more people are getting vaccinated, and I think more and more people may be wondering what they will be able to do as they get vaccinated. I understand that you have to wait 2 weeks after the first dose, and if you're getting 2, you should wait after that before you. But we don't seem to have any guidelines at all on whether people who are now fully vaccinated can meet with other folks who are fully vaccinated, as is now allowed in the United States. So when are we going to start seeing some kind of guidelines as to what vaccinated people, more of them every day, are actually going to be able to do?
It's a great question, Don. So we are working on that. And I will remind you that last week we relaxed the visiting restrictions around long-term care centers, other nursing homes, precisely because those seniors got double doses. I want to stress that Alberta's gone deeper into double dosing the most vulnerable than any other part of Canada. We've all had choices to make. Other provinces decided to focus exclusively on the first dose, which is, I think, a defensible position. But by giving the double dose to our most vulnerable, particularly seniors in congregate care and some people with serious health conditions, we've given them the fullest protection that we can. That's why we were able to be the first province to begin relaxing visiting protocols around nursing homes, long-term care, and the like. So we're looking at what other criteria we can give people for their conduct after they've received, for example, particularly the double dose. But right now, Don, our immediate focus has got to be ending this spike of cases. As you know, even if people are vaccinated, they can potentially they can transmit the virus. The chances of transmission apparently come down, but they don't go down to zero. So right now, we just ask everyone, whether they've been vaccinated or not, to carefully follow the public health guidelines, because we just got to get this spike under control. And once we've done that, Don, I really believe we can move forward. One thing that Saskatchewan, I would refer you to the proposal they released earlier this week, which ties the relaxation of public health measures to the percentage of population that has first and then second doses. I think it's a pretty thoughtful framework. It's one that we are looking at. But it's a good question because we are getting there, and it's a good I think incentive. Like, I'll just add this: we've seen some governments, some public health experts say that even if you've received the double dose, it makes no difference. You've got to stay permanently. You've got to stay shut down at home indefinitely. That, I think, disincentivizes people from getting the vaccine, especially the people who are vaccine hesitant. So we've got to give them, that's an extra incentive, I would say, and that's why we're working on that. But first, we got to get the spike under control. And in that respect, I am encouraged by one bit of data that we are seeing I think, a meaningful decline in the ratio of total cases to hospitalizations. As of last night, we were still at 146 ICU admissions, so we've been stable, even down a little bit on that over the past week, which is remarkable given that the number of cases that we are facing. So it tells me that we are seeing the effect of vaccines as people more prone to be hospitalized have that protection.
Don, do you have a follow-up question?
Yes, golf. Golf is limited to households now. I understand that other teams, other sports are completely shut down, so this is kind of a specific question about golf. Now, my experience of golf is 4 people gather, 2, 3, 4 people gather in one place for a brief time, hit the ball, and then go off in entirely different directions for the next 20 minutes. Isn't there a way that people could play golf, arrive in different cars, not go into the clubhouse, maybe mask on the tee, and still have a round of golf with 3 or 4 people who aren't household?
You know, you make I don't know, what's your handicap, Don, by the way? I do not have the patience for golf, so I'm not going to pretend to be an expert on this. But I think you make a decent point. Outdoor activities outdoor recreation is actually something that we encourage, but we are trying to, of course, limit social contact and interaction between people. So those are the goals that led to that policy. I will ask Dr. Hinshaw and her team to review that. Perhaps the Alberta Golf Association could come up with a proposed protocol along those lines where folks are not traveling in the same carts and they stay socially distant. I think now that the greatest risk, of course, when it comes to golf would be folks assembling for a post-game adult refreshment in the clubhouse and socializing indoors. That is not permissible now. So you make a good case. I'll bring that forward to the public health team.
Sounds like Don needs to keep it on the fairway. Operator, would you please put through the final question?
Charlotte Demulin, Radio Canada.
Oui, bonjour, Monsieur Kenney. J'aurais une question pour vous, s'il vous plaît aussi peut-être répondre en anglais à la suite pour cette question précise. On sait que la distribution des doses du vaccin Johnson & Johnson est mise sur pause depuis environ une semaine au pays. Alors, avez-vous parlé avec Santé Canada par rapport à leurs inquiétudes et leur approbation de ces doses que vous avez données aux camionneurs?
Oui, écoutez, notre groupe d'experts sur le vaccin est en discussion quotidiennement avec le Santé Canada à ce sujet et nous espérons qu'ils vont approuver l'utilisation de Johnson & Johnson. Ça a été utilisé, dizaines de millions de doses ont été appliquées aux États-Unis. Sûrement, je sais qu'il y a certaines inquiétudes, mais comme tous les vaccins, il y a un petit risque. Mais on a besoin de toutes les doses que nous pouvons obtenir aussitôt que possible. C'est le message que nous envoyons à Ottawa et j'espère que ça sera réglé prochainement. And I'm sorry, you want to mean in English on that as well. Our vaccine task force is talking to Health Canada daily about this, and we hope that they'll clear Johnson & Johnson for broader use as soon as possible. It's been used by tens of millions of people in the United States safely. It's a single-dose vaccine which doesn't require super cold storage, so it's very convenient. And we need every dose we can get right now, so we hope that they sort that out and clear that so we can add it into our vaccine program as soon as possible.
A final follow-up, Audrey?
Charlotte, oui, j'ai une autre question. Ça peut être juste en français. Vous en avez parlé en anglais il y a quelques minutes. Vous avez dit justement donc que des États américains, M. Kenney, seraient prêts à vous aider. Lesquels exactement et pourquoi? C'est quoi le problème présentement? Pourquoi ils ne peuvent pas vous envoyer des doses ici en Alberta?
I'm sorry. Audrey, your audio isn't clear, so maybe could you put that in English because I missed some of the words.
Oh, do you hear me well now? Yeah.
I think I'll get you better in the English with the muffled audio.
Sure. So you said earlier that American states will be willing to help you and send you some doses that they have in surplus. Which one exactly? Which states? And why is it not possible right now to receive those doses?
Well, I don't want to. Let me put it this way: the discussions we've been having are confidential, so it would be unfriendly of me to to put a spotlight on particular states, but we've had one state in particular has reached out, and another has expressed a willingness to offer us doses. These are both states in the region. They have very close economic ties, and they see this as an opportunity to reinforce that and our friendship. And they see what's going on in Alberta. They just want to be helpful. They're sitting on lots of extra doses. And I've spoken to those governors. I've really thanked them. They've told us their problem is U.S. federal rules that do not permit the export of vaccines, but they have said, perhaps we could have your people come and visit. That's just logistically complicated. I will note, as I said in my opening statement, that the Blackfeet Nation in northern Montana had a bunch of vaccines they were sitting on that were about to go, that were about to expire. And they put out an urgent call. I think they've done this on a couple of occasions to Albertans. At first, members of the Blackfoot Nation in the Kenney Reserve, and then Albertans generally. And I understand that at least 1,000 Albertans availed themselves of that opportunity. So we'll see if we can do things like that again. But the main thing is I asked Prime Minister Trudeau to please lobby the U.S. government to relax the export restrictions. It makes no sense for our neighbors and regional states to be sitting on doses that we cannot use. I will note that the state of Alaska has provided for vaccination for residents of some neighboring British Columbia communities. Alors, les discussions que nous avons eues sont confidentielles, mais il y a deux États qui ont approché l'Alberta avec une offre de partager les doses supplémentaires des vaccins. Et le problème est le contrôle de l'exportation imposé par le gouvernement fédéral des États-Unis. C'est la raison pour laquelle j'ai exigé au Premier ministre Trudeau d'intervenir avec le président Biden pour relaxer les contrôles d'exportation des vaccins pour qu'on puisse obtenir ces doses-là. Et je note qu'une des nations autochtones au Montana a déjà fait ça d'une façon urgente, mais il y a d'autres affaires. Je note également que l'État de l'Alaska a organisé une situation où les résidents des communautés proches à Alaska ont eu l'occasion d'obtenir les vaccins. Alors, nous espérons qu'il y aura une relaxation des restrictions des exportations aux États-Unis pour qu'on puisse obtenir ces doses-là. Thank you very much.
Thank you, everyone.